When I was at church, I was sitting in the chapel and I felt my right side getting heavy, so I started falling on the gentleman next to me and I kept trying to prop myself up. And about that time, John had walked in and had said hello to me, whispered hello. When I didn't respond, he realized that there was something wrong with me and he tried to help me up, and that's when I fell to the floor.
I noticed the paralysis on the right side of her body and that she couldn't speak. In my mind, even though she was as young as she was, it kind of went to, I think this is a stroke.
She was like thousands and thousands of other patients who had had a stroke. She had been fine earlier that day, but developed sudden trouble with her speech, difficulty expressing herself, and paralysis of the right side of her body.
Eventually, the paramedics came in and I could understand what they were saying, but I didn't realize that I wasn't communicating back with them.
And I remember them asking me, do we have a hospital of preference? And I said, I think it's a stroke. I mean, where would we go to the best place for a stroke? And I mean, I kid you not, two guys kind of looked at each other and said Methodist. I was like, well, that's where we need to go.
She received this clot-busting treatment, the TPA, tissue plasminogen activator, and within a few days she had made an excellent recovery.
I think when Dr. Chu came in and told us for sure that it was a stroke, my immediate reaction was, how is this possible? She's 27 years old, so young.
She was healthy prior to her stroke, had none of the traditional risk factors for stroke or vascular disease.
I ate well, I ran every day. I didn't realize that someone my age could have a stroke.
And it turned out it was because she had an underlying condition called a patent foramen ovale that she suffered this stroke. A PFO, or patent foramen ovale, is a congenital condition, and she had had this PFO since birth, but it had given her no problems until she was in her mid to late 20s. So it isn't until you have the unfortunate situation of a clot forming and passing through this little hole in the heart that you can develop a problem like a stroke. A PFO is actually not a rare condition. You can be a world-class athlete and have a PFO.
When I found out I had the PFO, Dr. Chu told me that there was an option to have it closed, to place a small device in there that seals it and then your skin eventually grows over it. So I elected to have this done so I didn't have to be on a blood thinner for the rest of my life.
It is not regarded as proven yet. Part of that is because we're so successful with medical therapies in preventing stroke recurrence. One of the concerns is the need for taking long-term chronic anticoagulant therapy, blood thinning medication, because there's always risks of medical treatment like that. So what we need to show is that you're actually better off with surgical closure than with medical treatment.
The team at Methodist Hospital was unbelievable. They were just so patient and so understanding and would explain everything as many times as we needed it, and just made us feel comfortable that we were getting the best treatment out there.
Go! Good job, buddy.
You wanna do it again?
Nicki is far from the average person. She is someone that from the very beginning has shown an indomitable spirit.
A lot of it is about education, educating people on the symptoms, educating on the importance of, recognizing and getting to the hospital quickly. Being there within that 3-hour window, from what I was told from Dr. Chu, it's a game changer.
They use the term FAST, where you look at someone's face to see if it's drooping. A is arms, ask them to hold up their arms, and if they can't, if they're not level. S is speech, ask them to talk or to repeat something back, and if they're not able to, then that's another sign. And then T is time. Time is of the essence. The sooner you get there, the sooner that you can get the treatment. To think back that this happened 6 years ago, and I'm fine, I've had no effects, back exercising. It's just amazing to think what I went through and where I am now.